Hello, and welcome to this Fast Five session entitled, Can You Provide Emotional PPE for Your Loved Ones Working in Healthcare? As the coronavirus continues to surge across the country, we realize healthcare workers and their PPE must stay vigilant and serving for months to come. Seeing the daily images of healthcare professionals on the front lines, donning masks and gowns, shouldering exhaustion, we wonder how we can all support them. So many of us have friends, family members, or neighbors who serve as physicians, nurses, chaplains, maintenance and cleaning staff, or social workers. In the spring evenings, neighbors banged their pots and pans at the appointed hour in unified thanks. But now, as the crisis wears on, what can we say to ease the burdens of those we don't share directly? What can outsiders understand about their days? After "how are you doing?" most of us struggle to know what might come next in a conversation. We run a coaching program for resident physicians at a large academic medical center, and 2 years ago we developed a list of 36 questions for medical providers. After reading the New York Times Modern Love article, 36 Questions That Lead to Love, we were inspired to write reflective prompts to foster conversation by suggesting entry points of understanding for those who work in healthcare. The literature on supporting well-being suggests that reflective writing and reflective conversation may buffer the stresses of work in healthcare that lead to burnout. The physicians in our program lit up as we asked open-ended questions about their lives and work. To answer, they tapped into a reservoir of memory or dream, their passion to make a difference, a moment of vulnerability not previously shared, or an aspect of life outside of medicine. We designed some questions that are specific to a day or life in a hospital setting, and other questions that are about who they are as people. We created these questions specifically for physicians, and yet they apply to most anyone working in the healthcare setting or interacting with those in need of the system, such as first responders. We offer these questions now as a set of conversations prompts that may serve as a means to support our loved ones and neighbors on the front lines of this global pandemic. With the continuing of the pandemic and the even greater clinical demands and stresses of uncertainty, we've added specific questions relating to working in the time of COVID-19. Here are some of the questions that we asked. I'll read a few of the 36. What time did you leave the hospital last night? What's your unique gift? When you have time to relax away from work, what do you do? Growing up, what did you learn about the concept of rest? What do you remember most about your first day as a resident physician, a first day as a nurse, as a member of the cleaning staff? What's the story of your name? If you could choose, what would be your superpower? What is the body fluid or function that you cannot deal with? Who will play you in the movie version? Will it be an action, a comedy, a drama, or a documentary? And what positive thing have you discovered about yourself in this time? What's been the toughest about COVID? What reactions do you notice yourself having? When was the last time that what you did or said made all the difference? Here are a few tips for listening. Ask permission for the conversation. Work can be overwhelming, and not every day is one for conversation about the topics that we share. One way you might enter this is by saying, I've been thinking of you so much and all you do. Would it be okay if sometime I asked you a bit more about your days? What would be a good time? Keep the focus on them. We often want to share how we have had a similar experience, or we know someone who's had a similar experience. However, the primary purpose is to listen to another's experience without changing the focus. Let their style and the quality of your relationship inform the kinds of questions you may ask. Some of the questions in the list are lighter, and others are more in-depth. See what one fits your relationship with them and who this person is. Make up your own open-ended questions. Anyone that is asked and can't be answered with a yes or a no is considered open-ended. And if asked with curiosity and compassion, can be a good opener to a deeper discussion. In a crisis, we often wonder what to say. Listening, on the other end of a powerful question, can deepen our ability to be with one another. Yes, each of us wants to do something, especially as we watch our friends and family in healthcare in action, doing what we cannot do. Yet our contribution, our doing, may be in being with one another in conversation, and listening can make all the difference.